we can open it up. So, got too many things open. There we go. All right. So, welcome to the monthly update for May of 2025. We're going to talk just briefly about the request for information. Then I will probably skip the PACIO background. We'll go into the use case updates, give you a quick update on US CDI 6 from last month, talk about Connectathon planning, upcoming conferences, and finally we'll go over, well, I think everybody here kind of knows the resources, so won't do that. But if there's anything here that you want me to cover that I'm skipping, please let me know. So just a reminder that CMS is looking for information regarding a variety of different proposed rules. It's a great opportunity for all of us to respond and give feedback. PACIO will not be providing a PACIO-sponsored response, mostly because, it would be sort of a conflict of interest because MITRE has been involved in some of these rules. But we encourage anybody in this group or in PACIO to respond on their own or form your own groups. But I think the deadline is like early to mid June, so
June 11th.
June 11th. So take a look, at these, and it's a great opportunity to give feedback to make sure that our voices are heard for this. So I'll skip the background and the use cases. The timelines here are pretty much the same. So the big things are we just finished ballot in transitions of care. We are trying to wrap up publication of personal function engagement STU2, and we're preparing for ballot in September for advanced directives interoperability. So standardized medication profile, Jeff Rochon of the Pharmacy HIT Collaborative is leading this use case. And the good news here is that STU1 was finally published. So it took a while because HL7 was redoing their publication process, but it is now published and officially out the door. So that's great news. And so, you can get access to all of the various things for the artifacts for standardized medication profile with these links. Transitions of care, Terry is on one of the use case leads along with Holly and James. And so this has been going through the ballot process, and so we are actively trying to recruit a patient advocate subgroup. So additional data elements may be incorporated as a result of that. If you are a patient advocate or know someone who is, we would love to have you join us to make sure that we can get as much good feedback as we possibly can. We have completed the May 2025 ballot. The ballot is now closed. We had 22 affirmative votes, 2 negative votes, which exceeds the 60% needed to pass ballot. And in ballot reconciliation, we have 8 submitted tickets, and we are in the process of triaging those. That's sort of the first step. Figure out, sort of look them over, figure out what we want to do with them, and then, try to put that together for discussion. The ballot dashboard you can get access to get up to the minute updates as to where we are in that process. But I think, hopefully there's one particular negative vote that will probably take some time to resolve. It has to do with terminology and things like that, and how we're structuring things in those terminologies. But other than that, I think at least through the initial pass, I think that we'll be able to go through these fairly quickly. So we'll see how that goes. And again, you can see the balloted implementation guide, and then we will be making changes as result of the reconciliation. So there's the latest version, which will diverge over time from the balloted version until we publish. And then we've got lots of sample data in our reference implementation client. With advanced directives, Maria Moen and is the use case lead. Lisa Nelson helps out there too for CDA, and then May Terry from MITRE is the technical lead. And so we've been doing a lot of work with, excuse me, creating these structures and working through and getting all of the various terminologies straight and things like that. And so, that has resulted in block votes that we're bringing forth to patient empowerment. We submitted block vote 2, which was approved, and we are preparing block vote 3, which will hopefully be the final one for review. And so we will be, as part of the 2025, September 2025 ballot, we need to have a notice of intent to ballot by June 29th. So we need to have a pretty good idea that we're going to be ready by that point. And then we have a content freeze date of July 22nd for ballot review. So that's like right after the CMS Connectathon. So that's what we're aiming towards, and looking forward to getting that into ballot and see what people think. Again, all the various different artifacts, the published STU1, what we're currently working on, the draft STU2. We also have test scripts as well in Inferno. Then personal functioning and engagement, Jamar Higgins and Alyssa Ford are the use case leads. Brian Michelle is the technical lead. And so, we've been working forward with this as well. Uh, uh, we went through the September 2024 HL7 ballot. We've been working through something that came up during our discussions was having the concept of a category tag or a tag cloud for around categories. We think we can do this without actually creating a separate category tag profile, which will make the implementation guide a little bit cleaner. And so we will be reviewing this with the HL7 patient care group for publication on May 29th. Well, then we'll hopefully, if things go well, we'll meet with the fire management group that'll be targeted for June 11th. And then there will be an HL7 technical steering committee. That's the final hurdle that we have to go through for the e-vote. It's usually an e-vote. And sometimes if they find something that they're questioning, they'll want to have a more in-person vote, but we'll see how that goes. And so we're targeting publication sometime in June for this. And then you can see the ballot dashboard there, which has the latest and greatest updates for what's going on there. We've started to talk about ST3 and really particularly around discussing more comprehensive support for devices and including perhaps a device definition profile. We're looking to, we've gotten at least fairly, decent way along that route. But we want to have a discussion with orders and observations, the HL7 orders and observations work group. They oversee the device stuff. And so we want to talk with them to get their sense of are we on the right track or not. So we'll be meeting with them shortly. Any questions on the use cases before I proceed? All right. We did submit comments for draft at USCDI v6, so that's all in. This is important because it helps drive what will be required in US Core, going Fire US Core, which will ultimately affect all what we do. And also it can lead to regulations as well. So it's good to get those comments in. Thank you for everybody who helped that happen. Next, I want to go into Connectathon planning. And so this is for the CMS Connectathon. It's a little different than the HL7 Connectathon. The real focus is on CMS. And so this is a great opportunity to show CMS our progress. CMS is our sponsor. They do pay for, MITRE, for example, to help lead and push these things through. We have submitted 2 track proposals, one for advanced healthcare directive interoperability and the other for transitions of care. We do have a tech team call every Thursday that covers this from 10 to 11 a.m. Eastern time. You can connect to that through the Zoom. We've been working on the scenario story. That story is frozen now, and so we are updating the track pages and moving on to the sample data creation and role determination. The sample data creation is often the most challenging part of preparing for a Connectathon, at least for PACIO. If you are interested in participating in the CMS Connectathon, please attend the Thursday calls. Because that's where the sausage will be made. So the Connectathon itself is July 15th to 17th. It's free. There's no charge to attend. Registration is now open. It's at the link below, and that closes on June 30th. So you have a fair amount of time to consider whether you want to participate or not. The agenda is a 3-day event. Day one will be presentations on policy and technology. Day two will be the active day for PACIO, we'll be doing testing and demos. And then day three will be all the track highlights. And so day one and day three are very different from HL7 connectathons. So day one is a way to find out about all of the latest updates from CMS, where they're planning, where they're thinking of going. And day three is there's actual presentations as opposed to filling out a Google Doc for all of your track report outs. There's actual presentations in this case, so you can really see in a more I guess interactive way of what happened at the Connectathon and see what other tracks are doing as well as what we've been up to. So it's a great event. So what we've been working on is, even though we have two tracks, we're really sharing a scenario between both tracks. And we're basing that off of this in September 22 and 24 Connectathon, where we had our patient Betsy Smith Johnson, who suffers a stroke and goes to the hospital, then a skilled nursing facility, and then a home health agency. And really, we focused on working out this scenario in whole, and then divide the appropriate elements into each of the tracks. And that helps, I think, provide some continuity for those who stay the whole day to show how the two tracks work together. So it's like an integration track, but it's not. So not like what we did in January. So we have as I mentioned, the two PACIO tracks. We are going to have the transitions of care, which includes personal functioning engagement and standardized medication profile in the morning, and then advanced healthcare directive and interoperability in the afternoon. The reason for this is that the transitions of care track sort of tees up the advanced healthcare directive stuff. So we can take the context that we cover in the morning and apply that to the work that the ADI team is doing. So there's really kind of four pieces to each of the schedules. There's the kickoff and overview, which will be 1 hour. We'll have 1 hour for testing. So that means that it's pretty much got to be working when we get there. So we'll be doing all of the testing prior to the Connectathon. The testing piece will just to make sure that everything kind of connects and it's basically working. We won't have much time to debug. Demo is 11 to 12, or that one, a third hour. Sorry, the third hour, and then the office hour is for Q&A is the fourth hour. And so we'll be doing that for each of the tracks. So the transitions of care will be from 9 to 1, and the advanced directive stuff will be 1:30 to 5:30. And our timelines, as I mentioned, we've frozen the scenario. We've gotten participant commitments. The next step is really having the sample data complete and have a draft of that, on June 5th. We'll have a couple more weeks to tweak it. Then we want to have the sample data frozen no later than June 19th. We'll do a dry run June 26th before the July 4th holiday. And then we'll try, if necessary, we'll do another demo run after the July 4th holiday. Hopefully, we won't have to do a third dry run, but if we do, we'll have to squeeze it in before the Connectathon, because as I said, we don't have time to debug things. So, and then the Connectathon testing and demo will occur on July 16th. Any questions about the Connectathon? All right. Conferences, we attend this. There's a conference going on as we speak, the EMEA 2025 Clinical Informatics Summit in Anaheim, California. Again, it's great that MITRE is not able to travel to these events due to the communication freeze and the travel freeze. So it's been great for the community to step up and present on PACIO's behalf, and we very much appreciate that. And it's really kind of keeping things going on that front. So we are updating, have several other conferences coming up as well. So there's HL7, the WEDI, Person-Centered Care. There's the CMS Connect-a-thon that we just talked about, the American Health Information Management Association annual conference in Minnesota, and the National Committee for Quality Assurance Health Innovation Summit in California. And so again, community members will be stepping up again for these events, and again, we very much appreciate that. These are great events to get the word out on what we're doing, and it helps I think build some demand for the work that we're doing, which really ties into our adoption strategy, which is kind of a three-legged stool. There's the USCDI piece, which promotes, the various different data elements that we care about. And then that historically has led to regulation. Um, then we have pilots, and we're in conversations with several HIEs there to see how we can move that forward. If you are interested in pilot opportunities, then please let us know. We're happy to entertain all of that. I think where we'd really like to move to pilots. And then we have the conferences really help, as I mentioned, to kind of build demand and show capability. So we want to, show people that may not be involved in the standards development process to see what is the art of the possible and what we can do there. And then that can help drive demand so that when they go back to their organizations, they can talk to their vendors and say, hey, I saw this cool stuff. I'd like to see this in your product. And so that can provide some demand to the vendors so that then they can take a look at what we're doing and hopefully implement it. So so the conference piece of that is really important. Just also wanted to mention the MITRE Health Interoperability Playbook. This talks about how we do, how organizations like PACIO, how we do what we do. It was based off of another project, the Cancer Moonshot project here at MITRE, which established the creation of the Codex Accelerator. And so we've taken the lessons learned from that as well as from PACIO and included that in here. So anybody who wants to create a community like PACIO and run it through for a particular specialty or portion of healthcare, this is a good go-to resource for that. It's got all kinds of information there, all kinds of pointers to things that helped make both the Codex and PACIO a success. And so it's a good resource, and I encourage you folks to check it out. We have a lot of meetings. This is the monthly observer call, the weekly contributors. If you're interested in getting more involved in the sausage making, that's every Wednesday later on this afternoon. The tech team calls, I mentioned Thursdays at 10 to 11. That's mostly on Connect-a-thon prep. And then we have all of our individual use case meetings where the real sausage is being made. That's getting down into the nitty-gritty of each of the items. So encourage you to check those out if you're interested in any of those areas. And then we have a lot of meetings with HL7. We have various different co-sponsors and sponsorships as well. And we have a website, Confluence page that has all of our meeting minutes, GitHub, which has our sample data as well as our reference implementations, which are all open source. And then we have lots of demos and Connect-a-thon videos from on YouTube. I urge you to check all those out. And that's pretty much it. Any questions? So I have a question. Since I'm not hearing any questions, I'll ask a question here. Is there anything that we can do to make this meeting or any other meetings that you might be going to with PACIO more effective? Or are there things that we could be doing as a project that's more effective?
I think it comes to getting the word out. So we're in process.
Yeah. Now, did you want to talk a little bit about what you're thinking with some of the
Yeah,
social media?
yeah. So I'm in the process of reorganizing the Confluence so that when people, like when we direct them to the Confluence, uh, the pages that need to be archived are archived, and the pages that they should be starting with, like the description of the use cases and everything, are updated. And then, of course, all of the meetings that I upload, the recordings and everything are updated. So that's step one. I'm working through that right now. I created an outline, and Yolanda's gonna give her feedback, and then I'll implement that. And then from there, I think it's time to start posting on the social media. I think the CMS Connectathon is probably a great first post. Um, and my plan is to kind of like cold invite people. Um, I have to look into LinkedIn a little more and kind of explore with that. But I know that I've gotten notifications that say things like so and so invited you to like this group. Um, so I'll be doing that. And and yeah, I think it's a good start. I think going forward, trying to keep the LinkedIn updated with our bigger events, especially as we get more people to follow it. Um, and also like once we're able to travel and once our community members that are traveling, we'll have them take pictures of the posters they present and the groups that they go with, and just from there, like hopefully it becomes more of like what looks like a big community project, which is what it is. But we just need to get some more hands involved, I think. And I think there are a lot of people that would be interested if they knew about it, providers and um, I tend to think students that are hoping to go to medical school or really any health program. I think that could be a really great demographic to target. And I'm going to look into how to best do that because I remember when I was applying to PA school, I wanted to do anything I could to make my resume and application stand out. Um, so I think that they'd be great to have input from. So kind of just a work in progress, but that is where we are with it, and I hope that those efforts will um, kind of get more of the voices that we need to complete the project involved.
Yeah,
Cool.
I think that's all great efforts. And then our PACIO poster is set up at the AMIA conference right now. I think it's the conference is from 20 to 22nd this month. And since we have nobody there, but the poster is lonely standing there. But I'm just
Well,
hoping.
let's get somebody to take a picture of it.
I think, yeah, we should ask Uba's friends to who
Okay.
help us set it up and take a picture at least.
Okay. Okay. Sounds good.
Yeah. Yeah, and also we can talk about the publication of the standardized medication profile, IG.
Yeah. Mm-hmm.
So,
Yep. So we'll start updating it.
excellent. Any other questions or thoughts? All right, well, thank you very much. Appreciate it, and hope to see you again next month and or sooner, hopefully. If you want to get more involved, happy to have you join us, and we'll talk to you later. Thank you. Have a
Thanks,
great day.
everyone.
Thank you. Bye bye.
Well, bye-bye.